I hope you know that. There are some of us more than me here. I want to tell you how pleased I am to be here tonight and to see such a good crowd. When you could be out doing other wonderful things in this wonderful city, you're here trying to make a difference. And I appreciate it, and I thank you for it, and America will thank you for it by the end of next month. I want to tell you a little bit of story about my own involvement with healthcare. I was in Washington, D.C. during the Clinton administration when Pat was in the Congress. And I helped a group of congressional wives put together a speakers bureau to go out to talk to Americans who, at the same time as we're looking now, believed, most Americans knew we needed reform. Most Americans in every poll said we've got to fix this healthcare system, it's broken. Most Americans agreed with us. And Hillary, with all the passion that she could bring to bear, came to Washington and said, we are going to change America. We are going to be fair. We're going to do the right thing by Americans by making sure that all Americans have access to health care. And guess what? And guess what happened? The insurance companies and the doctors at that time, the Medical Association and the pharmaceutical companies started running their ads on TV, doing just what they're doing now, trying to scare people into thinking we don't need change. Are we going to let them do that again? No! This is exactly, it's almost scary to think about the issues, how similar they are. Even though even more people, when President Obama was running, even more people said, yes, it's broken, fix it. And here we are back at the same place that we were then, with the same companies who will, by the way, if they get their way and they kill this reform this time, it will be the biggest transfer to insurance companies, the biggest transfer of wealth in the history of our country. Are we going to let them do that again? There's so much information going around this time. We all heard it, and I know all of you know they're all lies. All this business about the death panels and that the welfare reform is going to hurt senior citizens because it's going to cut into Medicaid. Nobody is saying anything in any bill before the Congress that would do any of those things. You know it, I know it, we need to make sure everybody else gets to know it. Are we going to let them get it away with it again? No! The other thing that's interesting when we look at how we were going to fund this was always what President Obama said as he campaigned. We are not going to make the deficit bigger. This is not going to cut into any other programs that America had currently in our budget. That's not what we're going to do. We might have to raise some people's taxes. Maybe some people who make $250,000 a year or more, who got the benefit, as all of you remember, of the Bush tax cut, maybe we could take a little bit of that money back and pay for health care. You know, the actual fact, if we just took back half of the Bush tax cut on the wealthiest Americans, half, we could fund these health care proposals until 2020. Why can't we do that? Are we going to let them get away with it again? No! In the next few weeks, the things you're doing now have to be multiplied many times over. We need to go out and talk to our neighbors and our friends and everybody we know. Take your Christmas card list, the list for your wedding invitations when you got married, anything you've got that you can do, send a postcard to people and say, stop listening to the lies about this program. This is going to be a good program. It's going to be good for seniors. It's going to be good for young Americans. It's going to be good for all of us. And for all of us who are in this crowd like me, who have health care right now, don't be so coy about it, because that's what's happening. They're scaring people who have insurance, and the fact of the matter is, we are one paycheck, many of us, away from not having it. And those of us who